Cabinet on the 14th of February endorsed that the Health and Safety at Work General Workplace Conditions Amendment Regulation 2021, known as 2021 Amendment Regulations, in relation to the No Jab, No Job regulations be revoked. Such revocation will be effective from today. The same is being published in the Gazette. The COVID-19 global pandemic greatly affected small island developing countries, such as Fiji, and greatly impacted the working populations, both in the formal and informal sectors. Fiji confirmed its first COVID-19 case on the 19th of March 2020. In response, the government initiated a whole of government and whole of society response with the Ministry of Health and Medical Services as the lead agency. Critical components of the initial response were border control measures, targeted public health measures, including restrictions of movement and gathering, lockdowns, enhancement of diagnostic treatment and surveillance capacities for the Ministry of Health, and budgetary supplements from the government. Collaboration and partnership with development partners, civil society organizations, and donors greatly complemented Fiji's responsive actions. At the workplace level, the devastating effect of the COVID-19 pandemic also affected workers, including their families, and employers, including their businesses, through work adjustments, change in terms and conditions of employment, and job losses. The COVID-19 pandemic has brought the health system of so many developing nations to a brink of collapse within months of outbreak, and Fiji was not spared. Therefore, essential aspects of infection, prevention, and hygienic promotion had to be maintained and sustained to ensure a healthy working population. Following the initial outbreak, the World Health Organization emergency dashboard on COVID-19 recorded Fiji's first case of the COVID-19 Delta variant on the 5th of April 2021. After careful analysis of the health situation and the status of employers and workers in Fiji, the government, through collaboration with its relevant agencies and the National Occupational Health and Safety Advisory Board, tripartite partners, recommend to Cabinet to formulate a policy for mandatory vaccination in the workplace. The main objective of the 2021 Amendment Regulations was to protect employers, including others, contractors, customers, and visitors from any risk of COVID-19 or related virus transmission at the workplace. The COVID-19 pandemic was seen as a threat to national health and to socio-economic development, and vaccination was a measure that protected against severe disease, reduced disease transmission, and to facilitate Fiji's recovery. The 2021 Amendment Regulation awareness was aimed at strengthening the understanding, the knowledge, and influence of employers, workers, and workplace duty holders on the responsibilities as stipulated under the Health and Safety Work Act 1996. According to the 2021 Amendment Regulation, in order for employers and workers to continue working and maintain access to the workplace, they were required to have received the first dose of COVID-19 vaccine by 1st of August 2021, and the second dose before 1st November 2021. As stipulated under the 2021 Amendment Regulations, the only exemption for vaccination applied to workers under the age of 18 years or for legitimate medical reasons. To implement the requirements of the 2021 Amendment Regulations, the Ministry of Employment, Productivity and Industrial Relations conducted a workplace audit targeting all workplaces Fiji-wide. The main objective of the audit was to determine the vaccination details and the status of all employers and workers at each workplace. The total workforce audited was 120,196 employees and workers, of which 99.75% had received the first dose of COVID-19 vaccine, and 99.72% were fully vaccinated. The workforce audited comprised of 17,333 employees, out of which 99.92% had received the first dose of the vaccine, and 99.84% had received the second dose of vaccine, and 102,863 workers, out of which 99.72% had received the first dose of the vaccine, and 99.72% had received the second dose of the vaccine. The second phase of the COVID-19 pandemic caused a huge impact on the working population. From the 2021 Amendment Regulation Audit Report, and child labor issues. For non-compliant workplaces, 36 workplaces were temporarily closed through the issuance of prohibition notices, and 5 workplaces were issued the relevant penalties. Of the total notices, requisition notice accounts for 66%, that's prohibition notice, and 16% close of business. Resigning notice, 10%, reopening of closed business, improved notice, 6%, and penalty notice, 2% of the total notice issued. Most of the prohibition notices were issued due to non-compliance to Part 14A of the 2021 Amendment Regulations on COVID-19 vaccination. The penalty notices were issued after verification that some workplaces continued to engage employees and workers that were not vaccinated. The total number of unvaccinated civil servants were 450 and accounts to 1.70% of the total civil service workforce. Therefore, 98.30% of the civil service workforce have been fully vaccinated. The total number of unvaccinated civil servants terminated was 341, which is 75.7% of the total number of unvaccinated civil servants. The total number of civil servants exempted was 109 and accounts for 0.41% of the civil service workforce, and 24.3% total number of unvaccinated civil servants. The government sets a target of 80% of eligible adult population aged 18 years and over to have received the second dose of vaccine by 1st November 2021. The campaign strategy and effort intensified with fixed and mobile vaccination stations set up throughout the country to vaccinate eligible population. By 4th September 2021, 566,210 individuals, that represents 96.5%, had received the first dose of the vaccine, and 299,943 had received the second dose, that accounts for 51.1% of the vaccine. Fiji had achieved 80% of the second dose coverage 23 days earlier than the target of 1st November 2021. Since the beginning of COVID-19 vaccination program, a total of 104.2% of the eligible target population had received the first dose of COVID-19 vaccine, while 95.5% received the second dose of the primary series. The rapid escalation of the rates of the first 2 doses of vaccines saw a marked reduction in hospitalization, severe disease, and deaths due to COVID-19 in the Western and Northern Division compared to the Central Division. The acute Delta wave in mid-2021. A single cross-sectional sero-survey funded by the Australian Department of Foreign Affairs and Trade through the National Critical Care and Trauma Response was carried out on the 24th of November 2021, 1st December 2021. This study demonstrated a high level of immunity in participants above the age of 18 years in the Central and Western Division in Fiji during the late November 2021 and early December 2021. Population-wide protection against severe outcomes of COVID-19 was experienced when hospitalization, against severe Severe disease and deaths due to COVID-19 remain low, despite the widespread of the virus from December 21 to February 2022, and from July to August 2022, and more recently in December 2022. Furthermore, the divisional hospital reported a lower number of COVID-19 positive cases, despite the 3 waves which supported the contention that COVID-19 safe measures reduce transmission of the virus when implemented with a highly vaccinated environment. The Ministry of Health COVID-19 vaccination program in terms of booster dosage and vaccination of children continues as a voluntary vaccination program. As of 23rd of January 2023, up to 90% of Fiji population over the age of 12 years are protected with 2 doses of the WHO-endorsed COVID-19 vaccine. Since the introduction of the booster dose program on the 30th of November 2021, a total of 54.6% have received the first booster, while 9.3% have received the second booster dose. COVID-19 vaccines remain the most critical tool against severe illness, hospitalization, and death by highly transmissible and deadly disease. The General Workplace Audit findings reveal that by the 30th of November 2021, the workplace vaccination directly contributed to the national vaccination rate of 97.6% for the first dose of COVID-19 vaccination, and 91.8% fully vaccinated by 1st December of 2021. From the Ministry of Health perspective, the 2021 amendment regulation helped to facilitate a broader level of community-wide vaccination. As of 23rd of January this year, more than 95% of Fiji's audit population above the age of 18 years have been vaccinated. The results of the General Audit 2021 provides a positive outlook on the status of immunization of employees and workers in Fiji, and complemented the information provided by the Ministry of Health on the immunization status of the total population of Fiji. Therefore, the objectives of the national policy on vaccination in the workplace were achieved as stipulated under the 2021 amendment regulations. The rapid attainment of high level of protection against COVID-19 have allowed the safe opening of Fiji borders and helped to facilitate early and sustained socio-economic recovery. One of the key controversies in the public health is the extent into which government can and should restrict individual freedom for the purpose of improving community health. The COVID-19 pandemic had created an unprecedented medical emergency with widely publicized consequences, both in terms of the disease itself and the effects of COVID-19 safe measures on socio-economic well-being. The vaccine was scientifically proven to be able to mitigate these consequences. The vaccine, as such, the implementation of the vaccine mandate was seen as a means to facilitate better disease control in a timely manner with less severe disease outcomes and rapid return to conditions that allow for rebuilding the nation's socio-economic space. Most of the countries who had mandated COVID-19 vaccination laws have recently either revoked or reviewed their mandatory COVID-19 vaccination laws after the transmission of the COVID-19 virus had been satisfactorily managed. For Fiji, the finding of the 2021 Amendment Regulation Audit highlights the high immunization status of employers and workers in Fiji. The objectives of the 2021 Amendment Regulation on vaccination in the workplace have been achieved. The implementation of the 2021 Amendment Regulations was deemed a necessity at the height of the pandemic to protect human rights, such as the right to life, to health and safety. The 2021 Amendment Regulation has achieved its intended purpose, therefore can now be subject to review. The Ministry of Health has provided serological and epidemiological data that indicate that Fiji has attained a widespread protection in terms of severe outcomes. Transmission production has also been demonstrated within fully vaccinated divisional hospital settings. As a proactive measure, the Ministry of Health will continue to push the booster dose through a number of initiatives that includes 1. Face-to-face education, awareness, broadcast and webinar sessions with the business and employers and workers for workplace booster vaccinations. 2. Collaboration and launching of tailored campaigns with vulnerable workforce including tourism sector, frontline workers at the border, airline workers, seafarers, and other networks. And finally, to promote the provision of information on vaccination and vaccination sites. The COVID-19 booster program should continue towards the improvement of health and safety of the general public, employers, and workers in turn to contribute to sustainable societal economic recovery.